Okay, what we're going to talk about is how we're going to do the lung inflation therapy per policy or procedure per protocol. So you have a kid here that's on pressure control 20/5 and a rate of 20. Now what we're going to do is, if the patient is spontaneously breathing and not vec'd, we can use the vent to do the procedure. So what we're going to do is we're going to look at what his peak pressure is. And in pressure control, we have a set pressure that's peak of 25 in this case. If he's in PRVC or auto mode, you're going to look at what is his peak pressure on his breaths, and you're going to use that number as your peak. So you're going to come in here, you're going to switch the vent to CPAP pressure support. You're going to turn the pressure support off, and then you're going to set the PEEP to whatever the peak airway pressure was or currently is on the patient. In this case, 25. Okay, then you're going to accept the mode change, and you're going to watch the patient and monitor the patient for up to 30 seconds as you do an inspiratory hold, if you will, during the lung inflation therapy. Now, during this time, you're going to see, notice that he's moving air through this PEEP, right? So it's a PEEP, so he can move air freely through it. However, it's producing the same volume in his chest at a constant rate as he was on his prior on his set breaths, on his machine inspiratory breaths. So after up to 30 seconds, you're then going to switch him back to his previous mode by hitting previous mode and accept, and document the treatment in Compass. When I say up to 30 seconds, that means if anything happens that you're uncomfortable with, or you don't think the patient is tolerating this situation or this mode switch, this therapy, then you can abort or shorten the amount of time that you're doing it for. So you could do it for 15 seconds or 10 seconds, 20 seconds, whatever the indication is at that moment. And that's how long you're going to do the inflation lung therapy for. That's as long as he tolerates it. And of course, you're going to chart why it is you decided to shorten the 30-second limit. The patient got agitated, got too tachypnic, CVP changes, various clinical indications that would cause you to stop the therapy.